Hi friends, good evening and welcome to my channel Mookambika Nursing. Today in this video we will see some question from gastrointestinal system. First question we can see a client has been admitted to the hospital with a diagnosis of acute pancreatitis and the nurse is assessing the client's pain. What type of pain is consistent with the diagnosis? First option A, burning and aching located in the left lower quadrant and radiating to the hips. Second option B, severe and unrelenting pain located in the epigastric area and radiating to the back. And option C, burning and aching pain located in the epigastric area and radiating to the umbilicus. And option D, severe and unrelenting pain located in the left lower quadrant and radiating to the groin. This is our question. So, a patient is admitted in the hospital with the diagnosis is acute pancreatitis and the nurse is assessing client pain. What type of pain here the patient may experience, that the nurse is assessing. So acute pancreatitis means it's an inflammation of the pancreas. Usually the pancreas is located behind the stomach and in front of the spine. So the area where the pancreas is located, that if the nurse she know means the area of the pain she can find out. Okay, and in disease condition that acute pancreatitis itself, it is clearly given that the pain associated with acute pancreatitis is often severe and unrelenting and is located in the epigastric region and radiating to the back. So in the clinical manifestation itself, it is there. It is an unrelenting pain located in the epigastric region and radiating to the back. So here our option is option B, severe and unrelenting pain located in the epigastric area and radiating to the back. This is in case of acute pancreatitis. Suppose in case of chronic pancreatitis, the pain may be burning and shooting type of pain which may come and goes but last for several hours in case of chronic pancreatitis. Next question, second question. A nurse is assessing a client who is experiencing an acute episode of cholecystitis. Where should the nurse anticipate the location of pain? First option A, right lower quadrant radiating to the back. Second option, right lower quadrant radiating to the umbilicus. And third option C, right lower quadrant radiating to the left scapula and shoulder. And option D, right upper quadrant radiating to the right scapula and shoulder. Here question is patient is diagnosed with acute episode of cholecystitis, that is acute cholecystitis. Cholecystitis means it is an inflammation of the gallbladder. So as a nurse, she should know where the gallbladder is located. Then she can identify the area of the pain. So gallbladder is located in the right upper part of the abdomen, right upper quadrant of the abdomen. So, and the type of pain we can see in case of acute cholecystitis, the client may complain of severe right upper quadrant pain that may radiating to right scapula and shoulder. So right upper quadrant pain, it may radiate to right side of the scapula and right shoulder. Here option D is the correct answer, that is right upper quadrant radiating to right scapula and shoulder. In picture we can see where is gallbladder is located. Gallbladder is located in the right upper part of the abdomen. So in our question option D is correct answer. Next question, third question. A client is admitted to the hospital with viral hepatitis, complaining of no appetite and losing my taste for food. What instruction should the nurse give the client to provide adequate nutrition? Option A, select food high fat. Option B, increase intake of low fluid and including juice. Option C, eat less often, preferably only 3 large meals daily. Option D, all of this. So a patient with viral hepatitis complaining of no appetite and losing my taste of food, that is the complaint of the patient. Viral hepatitis means it is an inflammation of acute inflammation of the liver. So in this case, as a nurse, what instruction should give the client to provide adequate nutrition? We will see. In case of viral hepatitis, we will advise the patient to take low fat diet. Our first option is select food in high fat diet. That is wrong. So we should advise the patient to take low fat diet because fat digestion is poor during the time of acute inflammation. And also we can advise the patient to take small and frequent meals, even large meals. Okay, why? In order to prevent nausea may be experienced during the time of hepatitis, so we should advise them to take small and frequent meal. And also we should advise the patient to take that adequate fluid intake, that is 2.5 to 3 liter per day. Fluid intake should be 2.5 to 3 liter per day. And also we should advise the patient to take nutritional juices. Nutritional juices is also important, that is patient is having infection, so we should advise them to take nutritional juices. Here our option B is correct, that is increase intake of fluids and including juices. That is the correct answer here. Next question, fourth question. A client has developed hepatitis A after eating contaminated food. The nurse asks the client for which of the following? Option A, malaise. Option B, dark stool. Option C, weight gain. Option D, left upper quadrant pain. Here a client with hepatitis A developed after eating contaminated food, and the nurse assesses that what signs and symptoms will come for this patient. So we should know what are the clinical manifestation of hepatitis, then we can answer this question. So we will see the hepatitis cause and symptoms. We can see symptoms include anorexia, nausea, right upper quadrant discomfort and weight loss. Fatigue and malaise are the most common clinical manifestation occurs in a patient with hepatitis. So here malaise, dark stool, weight gain, left upper quadrant discomfort is there. So our correct answer will come malaise. And the stool will be in hepatitis patient, the stool will be light or clay colored. Why? If unconjugated bilirubin is unable to flow out of the liver because of the inflammation or obstruction of the bile duct. So clay color, the stool color will be changed to light or clay colored. And that also we can see here option, it is dark color is there, it is wrong. Our correct answer is option A, malaise. The question, a nurse is caring for a client with a diagnosis of chronic gastritis. A nurse monitors the client knowing that this client is at risk of which vitamin deficiency? Options are option A, vitamin A, option B, vitamin B12, option C, vitamin C, option D, vitamin E. Here patient is diagnosed with chronic gastritis. Chronic gastritis means it's a chronic inflammation of the stomach. So as a nurse she should know that chronic gastritis patient may lack which vitamin? That is the question. So chronic gastritis cause destruction and atrophy of the lining of the stomach. Once the lining will destructed or deteriorated, it may cause loss of functioning of the parietal cells in the stomach. Parietal cells is usually secrete HCl and intrinsic factor. So the HCl production will decrease and the intrinsic factor will also lost, which result in inability of absorption of vitamin B12. So absorption of vitamin B12 is lacks means this leads to development of pernicious anemia. So the client may deficient vitamin B12 in this question. So chronic gastritis patient may deficient vitamin B12. Option B is correct over here.